when you've gone through the trade school and you're about $250,000 in debt, you need to process people quickly. And you're being paid by the insurance companies. So you're getting paid very little money. So what you do is you have your nurse or assistant take the blood pressure, they check it once, the guy doesn't even look at you, he looks at, hello, Mr. Jones. Your blood pressure is high, I'm going to fill you a prescription. If you don't take this pill, you're going to die.
Oh, thanks.
Is that, there's the copay. Yeah, that's about it. And now also, you need a proper cuff size. Now, about a year ago, a very close, loving relative of mine was in the hospital, the emergency room, and they were taking her blood pressure. Now, it caused extreme pain when they took it on her arm. And I said, you know, since it's hurting her, do you think blood pressure goes up or down under pain? Okay, since it hurts her arm, we take it on the leg? So he takes the same blood pressure cuff off the arm and puts it on the leg. And I go, wait a second, do you want to switch the cuff on that? No, this one will work fine. See, it goes around. Different size arms require different size cuffs. Does everybody have an arm this size? No, this is smaller than some and bigger than others, okay? It needs to require a different cuff. Do you think my mom's leg was bigger than her arm? Yeah, absolutely. And sure enough, when you put it on the leg, the reading read very, very low. I said, great. Now, since we're only concerned with the reading on this machine, can we get her off of the drug that's cancer-causing and can kill her? No. Okay, so now also, when you take blood pressure, you actually, what they do is they cut the blood supply off in the arm. Now, do you think your body's aware of this? Yes, it does. So what happens is, when you cut the blood supply off, the body senses that those arteries are compressed, oxygen cannot get to the tissue, so it vasodilates, or it opens up those blood vessels immediately after that compression. And heart rate increases and blood pressure increases to bypass that lesion. That's why if you take it sooner than 45 minutes to an hour, it's always going to be higher. Guess what frequency they take blood pressure at in emergency rooms? Every 15 minutes. There you go. Okay. Is that unscientific? Yes, absolutely. And if you answer that question on the boards, that you should take it every 15 minutes, you will fail the boards. Okay? This is how you have to answer them. Now, so what we're looking at is a combination of ignorance and arrogance. People are ignorant about normal human physiology. They're taught in trade school just to pass the boards. Now that's okay to be ignorant. If you ask me to work on my transmission, I'm totally ignorant of how that thing functions. I know where the key goes and the gas pedal. I barely know where the brake is. Okay? The function of the transmission, I'm totally ignorant of. But couple that with arrogance. You're the finest doctor trained in the world. Anything you say, what you've learned now is how human beings are. This is what healthcare is. So if you couple that ignorance with arrogance, what do we get in America right now? A third of our population is going to develop diabetes unless you're a non-white, which is most of us. Okay, that's 50%. Okay, developing diabetes. And this is, by the way, 100% curable, type 2. 5 out of 6 Americans are going to die of heart disease or cancer. Now, these are both 90% plus preventable. Okay, according to the top 19 industrialized countries in the world, U.S. is last. So is this trade school mentality where we're teaching people to pass the boards, but we're not teaching people about health, effective for our population? No, it's wrong. We have to stop the ignorance and arrogance. And this is the problem where you go in, you get one doctor that says, take this pill or you're going to die. You have the silent killer. And the other one says, my gosh, if you take that pill, you are going to die. Here's the studies. Who do you listen to? I'm going to show you who. First off, here, I go up to a doctor. And I tell him, this is the information that's made available to me. These are medications that are inappropriately prescribed to seniors. Now, they only test one drug. If you take 2 of these drugs, okay, it's incredibly dangerous. They don't even know. Now, my mom recently passed. She died. Now, she died also for medical care. She was actually had seizures, brought into another hospital, and she's already had multiple strokes. And that pretty much did her in. When I bring this list to the doctor that's treating her, and I say, look, there's multiple drugs on here you're giving my mom. Not only is it unscientific, but here's a journal article that says you shouldn't give it to seniors because it could kill them. You know what he says? This is what my training is. He doesn't say, oh my God, let me look into it.
Yeah.
Really, are there interactions? Let me see if there's something more healthy. Let me see if there's something more scientific. No, he did, this is what my training is. Inappropriate. And I'll tell you the stuff that I learned because I had the same training. Okay, so what changed me? This is one of the things that trained me. Remember, you are now doctors. Now we spend hours and hours and hours doing a fundoscopic exam. You know what this is? This is the back of the eye. Now, I need a volunteer. Come on over. Okay. I'm not going to really do a fundoscopic exam, just have a seat here facing that way. Okay, what we do on a fundoscopic exam, and this is the training. Remember, we're all portal of entry doctors. Okay, doctors of chiropractic, doctors of osteopathy, doctors of drug distribution. I mean, whatever they call those guys. Okay, so I'm looking in her eyeball. What I'm seeing is this. Now I'm marking down the macula densa, the color of it. I'm also marking down the AV ratio. Now I took extra study. I was in the diploma in neurology program as well. What we did is, during the training of that diploma in neurology program, we look at the fundus. And I'm marking down the AV ratio. I'm a really good student. Okay, I passed everything the first time because I know how to memorize and regurgitate. So I look in there, I wrote it down, and they said, okay, do an adjustment to stimulate the autonomics. And I said, okay, let me do an adjustment. That's it. Adjusted the finger, I go back in and look. AV ratio is totally changed. How can one adjustment radically change the ratio of arteries to venules? How can it radically change that in fraction of a second? And I'm going, wait a second. So does this nervous system control every function of the body? Yes or yes?
Yeah.
So if I affect the nerves, does this radically affect the eye function, the heart function, the lung function, every function? Thank you, you did a great job. Good job. Yes, should be here daily.
Don't forget to
So now this was a huge problem for me because I'm saying, wait a second, I spent hundreds of hours learning how to do this fundoscopic exam, and now I found out you can change it immediately by affecting the autonomic nervous system. Does that kind of make your brain start to, are those tests that I was regurgitating accurate or inaccurate? Let's look at my first blood pressure patient. Now, when you're learning and you're in clinic, you've already passed thousands of hours. You've passed 3 of the 4 national boards. You're feeling like you're pretty tough. And you're getting patients from the outside. You've gone through student clinic. You've had hundreds and hundreds and hundreds of hours of instruction and adjusting. And my physical exams lasted about 2 hours. I get this guy in. This is not him, but it kind of looked like him. Bright red in face, 325 pounds, 5'10". Good shape or bad shape? Bad shape unless he's a sumo wrestler. Okay, now I go in and I take his blood pressure. His blood pressure was 225 over 115. Say it with me. Wow! Okay, brand new doc, first patient with high blood pressure. What do? I go in and got another blood pressure cuff. Because I'm going there, this one's garbage. I check it again, it's super high. Same reading. Okay, because I checked in the other arm, I waited about 20 minutes, I did the fundoscopic exam and everything else. So then before you adjust a patient, in the clinical circumstances that you're in when you're training, you have to get approval from a doctor on staff. So I go up to one doctor on staff, he looks at the vital signs and says, oh my gosh, that's pathological high blood pressure. You can't adjust him, refer him out. Okay, now I'm going, I don't agree with that. Okay, for a couple of reasons. One of the reasons, if you refer this guy out, what are they going to do for him? What is any other help? They're going to give him a diuretic, a beta blocker, and I know those are toxic to the system, and I know his body is self-regulating, and